Self-medication has become an increasingly important worry in the healthcare environment. What exactly is self-medication, and are there threats involved? All this will be answered on today's episode of Healthy Living. My name is Kehinde Akinlolu. Welcome back to Healthy Living. Today we are discussing self-medication, and I have with me Dr. Kemi Shitu, who will help us with today's topic. Welcome, Doctor.
Thank you.
Doctor, what is self-medication?
Okay. So self-medication is used to describe a situation where an individual diagnoses him or herself, decides that this is the disease I have, and then decides that these are the drugs that I need to take.
Yeah. Okay. And what do you think is the reason why people practice self-medication?
Well, depending on the environment you find yourself, actually it's a global problem. It's just that it's more pronounced in some areas, much more than others. Some of the risk factors or some of the reasons why people would practice self-medication would be poverty, because they don't want to go to the hospital. Because healthcare in Nigeria has a lot to do with out of pocket, except for now where we have some insurance policies that are coming in and people can walk into the hospital and then get treated without having to drop any money.
Okay.
So because some people don't have money, they don't have the cash on them to go to the hospital, they decide to try one or two drugs. And then accessibility to healthcare too is also a problem.
Okay.
Because of the bad road network and then all of that. Some areas in Nigeria, or a lot more areas in Nigeria, we don't have easy access to hospitals. So I've talked about poverty, then affordability of these hospitals.
Okay.
Because a lot of the hospitals that people have access to are probably private hospitals, which cost more compared to public hospitals. Because when you get to public hospitals, you see queues.
Yes.
And then sometimes they feel the case they have is so emergent, or they trivialize it. They feel it's something they can still manage at home. That's also the reason why people.
All right, Doctor. Are there some illnesses or diseases that do not need consultation? I don't need to go to the hospital. So does that not equal self-medication?
Yeah. If there's any disease at all that you have to take drugs for at home, that's actually self-medication. Except there are cases like, say, for instance, you are a known asthmatic. And then in the hospital, you've been told that if you have an attack, if there's an episode, just use your inhaler. It's possible that you've not had an attack for like a month or two. And then today, suddenly, you had an attack. Just take 2 puffs, and that's fine. That's not self-medication because it has been prescribed to you.
Okay.
You understand? So it's not like every time you have an episode, you have to run to the hospital. So in that case, that's not self-medication. Or even if you have just a slight headache and you take paracetamol on your own, it's in a way self-medication. But but it's still a little bit acceptable, you know.
Okay.
And then even malaria drugs. Truth is that WHO wants you to be tested before you take malaria drugs. But because we are in a country where malaria is endemic, stays with us. And then if you find yourself in a situation where you cannot get yourself to the hospital immediately, you can actually take anti-malaria. But the ideal thing is actually for you to get to the hospital, get tested before you start the medication.
And in some cases, is it safe, like you mentioned malaria, is it safe to really self-medicate at that point? Because there are some cases where you've self-medicated for like 3 times and then the symptoms still persist.
Okay, so you don't need to wait 3 times to self-medicate. Yes. If you've done it once and the symptoms still persist, you should get yourself to the hospital.
Okay. So is there a point where self-medication can be considered dangerous?
Yes.
At what point would that be?
Well, now, for instance, if you are dealing with a child and you self-medicate on a child, it's quite dangerous. Because Nigeria is such a way that we don't have so many pharmacies around. And even if we do, not all the pharmacies have qualified pharmacists in them that can actually give you drugs at their prescribed dose for the appropriate age. So it becomes a problem. And if you self-medicate over and over and over, a lot of these drugs have side effects. And when you buy these drugs, they really don't tell you the side effects of these drugs. Okay, something happened to me recently. I was ill and I wanted to take a drug. It was a muscle relaxant that I've been prescribing to my patient for a while.
Okay.
And then I never really remember that he had the side effects of making you dizzy. And then I had been taking the drugs for like 2-3 days. I just realized my vision was blurry. I couldn't see. And then I was asking myself, what was it that I was taking differently? So I went back to the drug. Just imagine that was somebody that didn't know anything about the drug. So it was there I realized that, oh, it's this drug and I had to stop it.
Okay.
My vision was so blurry that I couldn't read on my phone.
Wow.
So we just prescribe the drug sometimes. If I've given it to a patient that I've used it once and realized that it's very good, makes him feel really good immediately, the person goes back
to get it.
Yeah. Without knowing that he has such side effects. He had more. He had what's more. You understand?
Yes,
yeah,
yes.
Okay.
Can we regard self-medication as drug abuse?
Yes. It's a form of drug abuse.
It's a form of drug abuse. So it doesn't matter whether it's just paracetamol or...
You can abuse paracetamol. Some people will tell you they don't take 2 tablets, which is the normal dose of paracetamol. They'll tell you if they have to take paracetamol for it to work, you take 3.
Wow.
Or take 4 at once. That's abuse.
And in the case of antibiotics, at what point do you think that, or rather, self-medication with antibiotics, what's your take on it?
Well, one of the most abused drugs is antibiotics, anti-malaria, analgesics, as paracetamol, ibuprofen, and all the likes. So, antibiotics, we are having a problem with it globally because there's a lot of resistance to antibiotics. And then when you come to the hospital, because you have taken so many antibiotics and didn't work, or you didn't take them properly, or you didn't complete the dose, or you took them at a very low dose, the organisms now develop resistance to this drug. When you come to, so they don't work for you anymore. We now have to step up to a drug that originally you shouldn't be taking them until when you have severe sepsis or things like that. So the problem with antibiotics is resistance, which is everywhere. Commonly, even with all these drugs, is resistance. Even anti-malaria. I'm sure you know that there is resistance to even this basic ACT that we use now these days because of the way people abuse it. You just go over the counter, just have body pain, take his malaria and just go and get it. So for all of them, mostly is more of the resistance problem. And then antibiotics is so much more abused that the resistance level to most antibiotics is really high now these days. So if you get to a point where you need to take antibiotics, I think you should actually go to a hospital. And there are some antibiotics that people actually react to.
Okay.
Yeah. So you should actually go to the hospital.
All right. There are cases where people go to, well, I say nurses or matrons that have like a pharmacy of your own to get drugs. Do you think that is safer than actually getting drugs?
I don't think it's safer.
Okay, even if the person works in a hospital and probably has an idea of those drugs.
I don't think it's safer.
Okay.
Yeah. I think you should get yourself to the hospital.
To the hospital.
And if you're meeting a very professional matron, they'll tell you to get yourself to the hospital.
Okay. So at no point should we visit a matron that works in a hospital. Let's just get to the doctor.
She doesn't have a maternity house or a clinic. She just runs something inside her house. I mean, she runs
probably like a shop or something, a pharmacy shop.
That's most likely a chemist.
Okay.
Because matrons, nurses are not licensed to own a pharmaceutical store.
Okay.
If you are not a pharmacist, you have no business owning a pharmaceutical store. And if you are going to own anyone at all, then you should employ a pharmacist. Yeah, I think that's very good.
Okay. All right. We'll go on a quick break. The discussion continues after. Don't go anywhere.
Take a break from your regular TV and fill your mind with inspiring, qualitative, and entertaining content suitable for the whole family's enjoyment. Broadcasting hope and life-inspiring messages from the Word of God. Foursquare TV is rich in life-changing and soul-lifting content, timely word of exhortation and word of knowledge delivered by our fathers in the Lord. Soul-lifting praise and worship that gives you that heavenly experience. Make a positive switch to life and enjoy Christian drama and informative content. There's never a dull moment on Foursquare TV. Decoders are available without subscription fee, and you have access to over 120 channels. For more info, please call 0803-304-6713, 0703-028-8661, and 0802-301-0696. Foursquare TV, life in full.
Welcome back to Healthy Living. Today we're discussing self-medication with Dr. Kemi Shitu. Doctor, I would like to ask, what are some side effects of self-medication?
Okay, so like I mentioned earlier, you can have drug resistance from medicating, from self-medicating. Then you can have unresolved symptoms, actually. You might be taking it, and if you're taking the wrong dose, you still have those symptoms and it doesn't resolve. So in a way, the effects can be sort of divided into maybe like short-term and long-term effects. Depends on how long you have been self-medicating on the drug and all of that. Now, if you also take an overdose, you can have a side effect. Maybe if the drug comes with loss of consciousness or some form of, like I said, dizziness, you might have some symptoms that were not really classically the initial symptoms you presented with, but because you were taking the drug in overdose. And then over time, you can have effects on your organs, like the kidneys, the liver, which helps to clear the blood, which actually metabolizes, the liver metabolizes those drugs, a lot of them, and the kidney helps to clear them from the system. So you can actually overload them, because there are some drugs that are actually toxic to the kidney at certain doses, toxic to the liver at certain doses. Because if you take even paracetamol, at some point it gets to affect your liver, and then you can have some form of hepatitis or hepatic issues. So you can have effects on your kidneys, you can have effects on the liver, you can have loss of consciousness for some people, depending on the kind of drugs they took. And then like I mentioned asthmatics earlier, there are certain drugs that we give to asthmatics. I've had some asthmatics abuse. For instance, in practice, when you're treating an acute episode of asthma, we tend to prescribe oral steroids. And then when we do that in the hospital, we actually do it for a short course. I don't know if you understand what I mean by short course. For a short period of time, maybe like 5 days or so. And we tell the patient to stop them. Because steroids have effects in the body after a long-term use. I've had patients that, because they feel their child or they are still having that symptoms, they go to the pharmacy and buy over-the-counter steroids. And they continue to take them. Continue to take them. Over time, they come down with side effects. Steroids have lots of side effects. It can even be as bad as you having diabetes from it, having cataract from it, and it has a lot of effects. So what even brought me to ask you?
Side effects.
So the side effects. So taking certain drugs for a long time, can actually, even though they are actually drugs that we prescribe in the hospital, can give you those side effects. Somebody can even die from taking drugs that they're self-medicated. So there's still a lot more actually.
Okay, I want to move on to hypertensive drugs. You know, some people are prescribed drugs because of they're hypertensive, but then I just want to ask, I want to clarify, should they continue taking those drugs, or is there a particular point they have to stop?
Okay, so like I always tell my patients, if you're hypertensive, I try to counsel you, because hypertension is such that once you start taking the drugs, you have to take it for a very long time. For some people, you take it for the rest of your life. For a whole lot of people, you have to take it for the rest of your life. Now, the problem I have with antihypertensive is the way it is prescribed. Usually in hospitals, general hospitals, we tend to prescribe drugs for like maybe a month or 3 months. So you have your you have your dose for,
For
3
3
months.
months.
What is expected is that you come to the hospital after that period. We check your BP. We tell you what we see. If you're doing fine, we tell you. If your BP is controlled, we tell you. If we need to step up the drug, we tell you. If we need to step it down, we let you know. And then we give you a refill in the hospital. But the problem I have is some patients, if I go to the hospital, they won't do anything for me now. They will just check my BP and write the same drug. So they will just go to the pharmacy and get the drugs themselves. Which actually, in itself, it breaks that routine clinic visit you should be having such a way that we should follow up on your BP. And when you have episodes of hypertension, you can just have it. And then you can die from it and all of that. And when you have cases of your BP that is not controlled as well, you can just have it and you can just have a heart attack and die. And you have those complications without it being followed up or noticed because you have broken yourself from the routine. So yes, antihypertensives are supposed to be taken for a whole lot of people lifelong. Yes, but the best way to do it is to always come to the hospital to get your refill for proper follow-up.
Okay. Moving on to administering drugs. There are cases where in the process of getting your drugs, you're giving the wrong drugs, or probably a mistake was made at that point. If you, as a patient, you notice that, okay, this is not what I'm supposed to be taking, what should you do? Okay,
so I've had cases where patients come into my consulting room and they're like, your pharmacy gave me an expired drug.
Wow.
It actually happens sometimes. It's clerical error and all of that.
Yeah.
So you may actually be given the right drug. But on getting home, you might realize that it's expired.
It's expired.
So at that point, you shouldn't take it.
Okay.
You shouldn't assume that they should have known. If they don't know that it is expired, they won't have given. That means it's still good. That's why they gave me, and you still continue. No. So you just bring it back to the hospital, and they change it for you.
Okay.
There are actually also instances where I've had to give some drugs to pregnant women, and then they go home, they read the leaflet, and they come back to tell me that it's contraindicated, like it's not supposed to be taken by pregnant women. Yeah, but if there are drugs that I'm sure of, I try to explain to them, explain what they mean there. Yeah, and then show them some evidence-based, what's it called? Evidence-based, because medicine is evidence-based. Show them some evidences that, oh no, yeah, it's written there. But since I'm the one prescribing it, these are the reasons I prescribed it. And for now, for you at this stage, it's not. Yeah, it's not. So you should actually go back immediately if you discover that you were given. That's for people that are very vigilant. You know, some people just get these drugs and just take them. They don't even take their time to read the leaflet or just go over it again. Maybe it's actually yours. They can even mistakenly give you a child's dose or give a child an adult dose. The same drug actually. Give you an adult, but you should actually quite take your time to check it and then return immediately or go back immediately. If you are confused, please go back immediately. They can actually give you a drug as well that maybe you should put it under your tongue and then they say you should swallow it. You know, you can read it from the leaflet. You can also go back to the hospital immediately and then they clarify for you and all of that. So you should actually go back immediately.
And also, with still on drugs that are administered properly, if you administered a drug and then you notice that the side effect is probably strong on you, like you said, you were dizzy or something is just wrong with you in your body, should you stop or should you continue?
No, you can stop and then get yourself to the hospital.
Okay.
I've had instances like that where, I think there was a time, not to go too personal. I had someone very close to me that is asthmatic.
Okay.
So I practically dragged him to the hospital. So they prescribed a particular inhaler for him. It was a little technical for somebody of his age to use actually. So after using the kernel for a month, he told me that it wasn't working, that he wasn't going to the hospital again. So I told him that, no, that's not how it works. There are different kinds of inhaler. If this one is not working for you, just go back to the hospital. They will give you another type. You understand? And the reason it's not working for you might be because maybe you just don't know how to use it. So when I dragged him again the second time, he went and they gave him, and he's still on his inhaler now. So they changed it for him. And I tried to change this one he's using right now, and he's saying, oh, no. that he still prefers this one. So you might just need to change the drug for you. So all you need to do is present with, not just stop the drug and stay in your house. You can stop the drug, bring it back to the hospital, and then let us see it. Tell us about, a lot of these antihypertensives still have symptoms. So what we tell patients is, when we try and tell them the symptoms that can come from it. So once you start experiencing this, you can come back to the hospital, we change the drugs for you. And if you think there are some that you can actually live with, if it's okay for you, fine, you can continue. But just present with the complaints.
All right, the very last question for today. What do you think is this? What do you think the government or the society has to do to curb self-medication?
I think there need to be some policies in Nigeria. Not just making policies, but enforcing them. There are so many drugs that people have access to over the counter in the pharmacy that they actually shouldn't. That's why we have a case of so many drug abuse with our teenagers and young adults these days, where they abuse a lot of these codeine drugs, which are actually good drugs that help with for the purpose for which they are created for. So there should be some policies in place, and there should be some way of enforcing those policies, so that people don't just go to the counter and buy these drugs. And then 2, accessibility to healthcare also helps. If patients know that the hospital is just close by here, they can easily get into it. It's not like they have to jump from one bus to another before they get to the hospital. Yes, they will go. And also, if they know the healthcare is affordable, like they can walk into the hospital, and whatever cost it is, they can easily pay it. Or maybe some form of insurance scheme, which is working slightly now, because there are a lot of insurance policies, health insurance, whereby so somebody can, if you have a good health insurance, it doesn't really have to really be fantastic. At least for basic ailments, a lot of people, elderly ones these days, can walk into the hospital without paying a dime, get tested, get treated, even admitted sometimes without paying a dime, and they are treated, and then they can go back to their homes. So I think good policies, enforcement of policies, accessibility to healthcare. That means we need more hospitals, we need more government hospitals, we need good roads to access those hospitals in case of emergencies, affordability of this healthcare, and then we still need to talk to people about it. So we still need to advocate the fact that it is very good to self-medicate. It cannot be overemphasized, so we have to just keep talking about it. I think with that, we get somewhere.
Thank you very much, Doctor.
You're welcome.
That is all we can take on this episode of Healthy Living. Remember to not self-medicate. If you have any issues with your health, please visit a hospital. Till I come your way next time, my name is Kehinde Akinlulu.